is it? It's garage time, ladies and gentlemen. Phase 2, elbow tendonitis pain treatment / prevention program. We're bringing strengthening into the garage for the first time. Typically when you have some sort of injury, it's a 3-part process. We're going to do soft tissue work, restore the sliding surfaces, get all your trigger points out. Number 2, some sort of range of motion, stretching essentially. And number 3, strengthening, because when you have an injury, the muscles tend to get weaker because they're not being used properly. And so we need to bring that strength back up to get you back to 100% functional. Yet when my elbow pain set in, I thought, yeah, flexibility, trigger points, those are issues, but strength's not my problem. Hell, I've got a 400-pound deadlift, so I can hold a 400-pound barbell in my hands. How could grip strength be a problem? I can do pull-ups, pulling a near 200-pound body up over a bar. Again, grip strength, really good for that. Yet when I brought strengthening into the equation, things got better. Why? Well, essentially, your body and your muscles have an unlimited supply of phone-a-friend lifelines from Who Wants to Be a Millionaire. That's right. When a muscle starts to run out of gas and can't do the job you're asking it to, it phones its neighbor and says, hey buddy, come on over and help me out. Eventually, over time, that muscle that's doing the compensating steps in and continues to do the job, and the muscle that originally was asked to do the job and was designed to do the job is now on vacation, and we end up with a compensatory issue. And then we get overuse because muscles are doing jobs that they weren't designed to do. So we've got to strengthen it. And we've got to bring those muscles that are supposed to do the work back into the equation and get our compensators out of there and let them do only the one job that they were designed to do. So I'm a huge fan of functional strength, movements that strengthen the whole body at once, but when we're dealing with an injury, we need to look at the specific area, the specific movements that are giving pain, and what muscles were specifically designed to do that, and odds are we're going to find a weakness. As we bring that strength back up to where it should be, we fix the problem. So in our wrist, we've got 6 movements here, okay? We're going to go through them. We've got flexion. We're going to move the wrist towards the body, and we're going to come back. So we've got our band set up here. We want to remember, we're going to focus very specifically on the negative or eccentric portion of the lift, okay? So we're going to do 1 second towards the body, and a 2 to 3 second very slow return. And for all of these movements, we're going to work up to the ability to do 30 repetitions in a row. So we're not just building strength, but we're building endurance. So we may start with 2 to 3 sets of 10, escalate it to sets of 15, then maybe 20 in a row. And eventually, when we can get to 30 in a row with minimal fatigue, odds are we're going to feel better and the pain's going to be gone. So that's your flexion. Flip around. You've got your extension. Away. And let it come back nice and slow. 1 count out. 2 count towards. Okay, we've got supination. We're going from palm down to palm up. And nice and slow. Remember, not letting the band win. So we're slowly returning to the beginning. Okay? Then we're going to go from a palm up to a palm down. This is our pronation. Okay? And then we've got our 2 deviations. Ulnar, okay, is moving to the pinky side, and radial is moving to the thumb side. So we've got thumb side first, so thumb goes out, comes back to where it started. Flip around, pinky side out, back to where it started. So we're working up to 30 repetitions of each movement. We've got 3 pieces. If we go back, we've got our soft tissue work with our lacrosse ball, we've got our gentle stretching, then we're going to bring our strengthening into it. And I want you to think about one other thing if you're dealing with elbow pain. Go back and watch my thoracic spine video, because you've probably got something going on there, because the spine's the beginning of it all. So check that out and see if there's anything you need to work on. Soft tissue work, stretch it out, re-strengthen it, get rid of the elbow pain, Check back for the next episode. See you next time.